Today we are having two very interesting topics. However, the first topic of discussion today is combating tuberculosis. Now, this comes as a result of the celebration of the World Tuberculosis Day on Sunday, that's March 24th, 2019. And the theme was, it's time, let us end TB. So today we're talking about tuberculosis. And in the studio today, we have Dr. Charles Nwachuku. He is a general health practitioner. Good morning.
Good morning.
Thank you for joining us today.
Thank you.
Yes.
Now, before we go into the subject of today's discussion, we need to take a very quick look into a video on tuberculosis from Ethiopia. Please stay tuned.
TB is always among the top 5 diseases which contribute to high mortality and morbidity in Ethiopia. It's a poverty-related disease, and controlling and preventing TB is very important, because when you prevent it earlier, then you also prevent future consequences. TB works on tuberculosis prevention and control in Ethiopia. We work in 2 large regions. The 2 regions have a population of about 54 million. That's more than half of the Ethiopian population. In the last 5 years, we have started to see improvement in the prevention and control system for tuberculosis. We still think that we have many cases, many missed cases in the community, but with the improvement, with the interventions that we have put in place, we have seen a decline in the number of cases, which is a positive trend. The team work that we have there and the results that we see, they keep us motivating. We want to achieve more. We also want to see more successes. In the future, I want to see Ethiopia eliminating tuberculosis.
Now, today, we have to talk about the scourge. We have to talk about this thing that could have been eradicated. I mean, This is 2019. A lot of actions, a lot of measures need to be put into place. But first, let us understand tuberculosis.
Yes.
What is it?
Tuberculosis is an infective condition. Is caused by a bacteria called Mycobacterium tuberculosis.
Okay.
So Mycobacterium tuberculosis belongs to the family of Mycobacteriaceae. There are a couple of them, but the Mycobacterium tuberculosis is primarily goes to the lungs. So that's why it has to do with the respiratory system. That's where the primary infection, occurs. And normally in our environment,
yes,
because of the microorganisms in our surroundings, and then the body also has an immune system.
Yes.
So you can actually have tuberculosis living in your body for a period of time. And then it doesn't cause a full-blown disease.
Okay.
So that's what, we'll come to that later. That's what's called the latent tuberculosis.
Yes.
Yeah, so the body's immune system is supposed to take care of infections from time to time. Like every day we're exposed to microorganisms and infections, and we don't get sick. So the only time we get sick is when there's a breach in the immune system. So just like every microorganism, Mycobacterium tuberculosis is around us, is in our environment, is everywhere. So it's only when there's a breach in that immune system and some other conditions which we'll talk about later. So that's when we have tuberculosis.
When does it get active? When the immune system is compromised, right?
Yeah.
Oh,
basically.
So when does it get visible? What are the symptoms, the signs?
Well, for the latent tuberculosis, you might not have a symptom. You just live your normal life and nothing happens.
Okay.
For how long can it be within you? Yes. For how long can it be latent?
Yeah, as long as your immune system is okay. I won't be surprised if the 3 of us sitting down here have Mycobacterium tuberculosis.
No, that's scary.
No, for real. It's like that. Even when you have HIV, right? That's why they said you should go and test and know your status.
Yes.
Because most of the times you could be positive and then you don't have any symptoms.
Yeah, asymptomatic.
So yeah, you could have mycobacterial tuberculosis and not have any symptom. But however, whenever symptoms present, that's when you have the tuberculosis disease. You understand? So usually, because it goes to the lung first, you have some respiratory symptoms, cough
Right.
being the most common. So you can have maybe chest pain, breathing difficulties, but there's also an issue of progressive weight loss. There's you can have fever, unexplained fever. You know, in our environment, most people when they have fever, they just think it's malaria, and then they take malaria medicine. Some go as far as taking typhoid medicine too.
Yes.
Yeah, a couple of times I've been in the clinic, and when patients come, the normal routine. So why have you come to see us today? Or they'll be like, doctor, I have typhoid and malaria.
Self-diagnosis.
So how do you know you have typhoid or malaria? So most of the times they'll tell you, oh, they've taken malaria medicine and typhoid medicine per se, and then the fever doesn't go away. So unexplained fever could also be a symptom of tuberculosis. Then I talked about progressive weight loss.
Yes.
Yeah, and then there's what we call drenching night sweat.
Okay.
Drenching night sweat. So yeah, occasionally when you're sleeping at night and then you sweat profusely. Especially if it's something unusual. Like, you know, some people they sweat more than other people.
More, yes.
Yeah, but when you notice you sweat a lot at night,
And it's not normal.
and it's not usual, it's not something that usually
Yes.
happens in the past, so you can have that. And then the cough,
Yes.
in most cases, is usually productive. That means you actually cough something out.
Something up, yeah.
Yeah,
Okay.
we call it sputum. Yeah?
Okay.
So sometimes the sputum can just contain mucus. Sometimes it could be, you know, pus-like. In rare cases, it could contain pus. And then in other cases, it could also contain blood.
I was
Yeah,
going to
so
ask.
if you have a productive cough, and then especially if the cough is more than 2 weeks, cough less than 2 weeks could be maybe due to cold virus or just dry cough that could be an allergy to something, a trigger in your surrounding. But if the cough is greater than 2 weeks, it is significant and you have to go
You need to go see your
screen
doctor.
for. It used to be 3 weeks before,
Okay.
but then it was brought back down to 2 weeks.
So at what point do you run to the doctor and say, please help me? Is he under that 2 weeks or after?
Ideally, if you're coughing for 2 weeks plus
Something is
1
wrong.
day, you're supposed to go to the hospital. But we have a poor health-seeking behavior around here.
True.
You understand?
Use,
So most people don't go to the hospital except if something severe.
Yeah.
I think it's very bad. Even among we doctors, most times we have a headache. You know, if a patient comes to the hospital and the person has headache, first of all, we don't go into something very serious or invasive at first. Well, we say, oh, drink a lot of water, have enough rest. But we work with the headache and we don't do what we say. So most times people come to the hospital when the symptoms are, you know,
Really terrible.
yeah, getting to the extreme. So maybe when it's affecting their work, they can't go to work again or something. So, but if people are coughing for 2 weeks and they could still carry out their normal daily activities, except the person is highly educated and informed. Why? So the person is less likely to present to the hospital. So this is like the benefit of this program we're having here
Yes.
and all the
Create
tweets
your awareness and everything.
and social media awareness we created on Sunday.
Yes.
Yeah,
that's
so that's what we put out on that day. If you're coughing more than 2 weeks,
Or maybe you notice someone
notice-
coughing more than 2
yeah,
weeks.
oh yeah, okay, that's what the risk factor. We'll probably come to that later.
Okay.
But oh yeah, since we're here, so if you're coughing more than 2 weeks,
Yes.
we're not saying if you have fever, if you have weight loss, if you have drenching night sweat, if you're coughing more than 2 weeks, you should go see a doctor.
Okay.
So you get screened. I mean, what's the worst? If it's negative, then we could look at other causes. And then just like you said, since you already mentioned it, that's correct. Because tuberculosis is an infective condition, right? It could pass from one person to
To
another
the other.
through aerosols and droplets coming from you coughing and then sneezing. Yeah, because, you know, when you sneeze,
Release
millions
that.
of particles are released, but we don't see it.
Yes.
There was a picture I saw one time. It was a microscopic picture of the contents of the stuffs that come out when you sneeze.
Yes.
There were a lot.
I can
If our eyes
imagine.
can see it.
You'll run
John,
every time.
So imagine being in a taxi. You know these taxis that carry 4 people at the back?
Oh, my.
And then someone sneezes, and perhaps there's a mycobacterium tuberculosis.
Okay.
So every other, oh, wow.
Yeah.
There's no way to run away from that.
You can't help it.
Do you understand? So it's passed from one person. So if there's somebody close to you who's been coughing
Okay.
for more than 2 weeks, you understand? That person is said to have mycobacterium tuberculosis until proven otherwise.
Okay.
So there's also an increased likelihood that he or she might have passed it to you.
Yeah.
And then you
So you should go for screening as well.
screening.
So in that case, you don't have to wait for your, if you're coughing already, you don't have to wait for your cough to get more than 2
Worse.
weeks. You know, so that doesn't, so cough greater than 2 weeks as a point is different from being in close contact with somebody who is coughing for greater than 2 weeks. So we're not saying even if you're in contact with somebody who has cough for more than 2 weeks, that you have to start coughing up to 2 weeks and above before you should go
Totally
get
noted.
tested.
Okay.
Please.
Please be informed that the phone line is now open and that you can call in. You can also drop in your comment, or rather drop your comment on our Facebook page because we are streaming live. The number to call, of course, is beautifully displayed on your screen, as someone would always say, plus 705, plus 234 rather, 705-143-2258. So you can call in, ask your questions, give your feedback, your contribution, whatever that you have. And of course, you know, we will take it. Now, tuberculosis.
Yes.
If I can guess from your explanation, I can guess the modes of transmission. We have when someone sneezes,
Coughs,
droplets.
droplets
Yes.
also from the respiratory tract.
Do you get it? Now, popular opinion, or maybe it's a myth. Some say if you share spoon, cup,
Yes.
plate, cutleries with someone who's infected, you could actually be opening up yourself to that. Is it true?
Well, you know, in medicine, we say never. So there's nothing like 100%. And there's always this saying that in majority of the cases, this is how it could, you know, occur. So in majority of the cases, you can get it through the sneezing and coughing, because those ones have the content directly coming from the lungs.
Okay.
But sharing spoon and plates with someone who is already infected and then maybe kissing them and having in contact with their saliva, I would say if you can avoid that, it's
Then
better to
please
be on the safe
avoid
side. You understand? So you won't go ahead doing all that, saying that, oh, it happens in, let's say, a small number of cases. Yeah, there's nothing that has ruled out completely that you can't get it from those sources. Do you understand?
Yeah.
So that means we don't have enough scientific
Enough,
backing
For
for that.
that, yeah.
All right.
So it hasn't been ruled out completely.
All right. But for now, just
But for
stay
now,
safe.
so if you can stay
Avoid
safe
it.
and avoid it, I mean,
You know, yeah, but how often should one go for checkups, like, to be sure that one doesn't have tuberculosis? Because I know the early stages don't really have signs like that or symptoms for you to tell that, yes, you're infected. So how regularly should we go?
well, for tuberculosis, if you don't have any symptoms, it might not really be necessary for you to go for checkup per se, because if you have it actually and you start treatment and you comply with your treatment, it's actually curable, right?
Yes.
So you have to have the symptoms or something related to the respiratory system, or maybe you might have a pneumonia, or maybe you're going to the hospital and you have some maybe fever, chest pain and cough, which is less than 2 weeks, or like you have conditions which do not match directly with the ones related to tuberculosis, and then perhaps your doctor made a diagnosis of maybe a pneumonia or bronchiectasis or one of the respiratory tract conditions. So they might decide to just screen you for tuberculosis.
Okay.
You know, just to rule that out to be sure that you don't have it.
Have it.
Yeah, but like, you know, if it would be very nice if we get to that point when people just stay and go to the hospital and say, "Oh, I want to screen for tuberculosis."
That would be nice. Okay.
Yeah, so-
All right. So aside sharing the same space with someone who's
Yes.
infected, you know, and maybe other breathing in that they're discharged,
Yes.
are there other risk factors?
Oh, okay. Okay. You remember when we talked about latent tuberculosis?
Tuberculosis.
Yeah. So when you have it in your system, there are conditions which trigger a reactivation and then cause an infective condition. So
Conditions like?
overcrowding, like we already said.
Yes.
Yeah.
So that explains, in an overcrowded room, there's an increased chance that somebody who is infected will pass it to another person. Then malnutrition.
Oh.
Yeah, so
Okay.
you remember we talked about a depressed
Immune
immune system.
system.
Yeah,
Yes.
so a malnourished person, will definitely not have a total, cool immune system,
system,
because
yes.
like you need proteins,
Yes.
like vitamins,
All the
and all that,
vitamins,
yeah,
yes.
to build up your immune system. So that's why in children with kwashiorkor, so
That's sad.
they are likely to
To have it.
get it if they come in
Yes.
contact with someone
Anyone
who
that has
has tuberculosis.
So basically, anyone is at risk.
Yeah, that's what I'm saying, that I won't be surprised if we all have latent tuberculosis. I'm not, well, anyway. But what I'm saying is these conditions will,
You've listed. Okay.
so the overcrowding, malnutrition, and then HIV, that's very, very significant. That's very significant.
Okay.
Everybody who has HIV that comes to our hospital, we screen for tuberculosis.
Tuberculosis.
Because you know what the HIV does?
Suppresses the
It
immune
suppresses.
system.
That's it.
Yes.
The HIV doesn't come to target any of your organs. It doesn't
Your
come
immune
to.
system.
It doesn't even. It just comes for the immune system. What it comes is depress the immune system very fast, rapidly, so that any microorganism or any infective organism you come in contact with.
Yes.
So that's why HIV patients, most of their symptoms are non-specific. It could be from one organ or the other as a result of a depressed immune system. So there's most of the people who die from tuberculosis are HIV positive. Because,
The immune system is weak already, so
Yeah, so anyway.
the HIV depresses the immune system. So anybody who's HIV positive must screen. In fact, those are the people that if we screen and they are not, they don't have tuberculosis, we put on prophylaxis. Prophylaxis is like a preventive treatment.
Okay.
There's one of the drugs for tuberculosis, isoniazid, that we use for prophylaxis. That's like preventive. You give them for like 6 months. We'll probably talk about that later too. But HIV must be screened for tuberculosis. And then drugs, if you're on steroids, for the same reason, steroids depress the immune system as well. So the intravenous steroid drug users, they are at risk as well. And then if you have some chronic conditions, if you have a cancer, and because most of the cancer therapy, the chemotherapy, the drugs for cancer, most of them also depress the immune system, and some of them can also be on steroid. So,
Thank you.
having some other chronic medical conditions, and if
Make
you're
you
dealing,
prone to
if you're dealing with a liver disease, chronic liver disease, and all that, anything that tries to tamper with the smooth running
of the immune system
and the body in total, could.
Okay.
Yeah.
So let us go watch this video from WHO, World Health Organization. We'll be right back.
Tuberculosis may seem a thing of the past, but it's actually the world's top infectious killer today. Over 5,000 women, men and children still die each day from TB. Multi-drug resistant TB is also a top global health security threat. It is airborne and can affect any one of us. Yet, global actions and investments to end TB are falling far short of the targets set by the United Nations Sustainable Development Goals and the World Health Organization's End TB strategy. Among global health development efforts, investing to end TB is top value for money, with a return of over $40 on every dollar invested. To drive down TB deaths and suffering, we need intensified political commitment, multi-sectorial action, and more investments. Ministers and other global leaders from across the world will meet for WHO's Global Ministerial Conference on Ending TB in the Sustainable Development Era to commit to ramping up the fight against.
Wow, that video was quite informative. It just tells how deadly, tuberculosis is and the need to actually address it and talk about it like we always do on Tea or Coffee.
Yes, we always do that. So what are the cure? How do you cure tuberculosis actually?
Oh, okay. So when you come and the normal pattern of management in medicine, we take a history, we do examination, and we do some investigations. And then if you're confirmed that you have TB, so we place you on some drugs.
Drugs, yeah.
So there are different classes, actually. So for a newly diagnosed tuberculosis patient,
Okay.
so the treatment is for 6 months.
Okay.
So there's an intensive phase of 2 months and a continuation phase of 4 months.
10 months.
Months.
No,
Wow.
intensive.
Okay,
is
within
2
that
and
6
4.
months.
Yeah, it's the 6 months is broken into 2 and 4 months. So
Okay.
the intensive phase is the 2 months. The first 2 months, they're like a combination of 4 drugs. Also isoniazid, rifampicin, ethambutol, and pyrazinamide. So, so no, but this is not to scare anyone.
No.
You understand? So that's like it's called an intensive phase because it's like the earliest time that you need to combat the organism, right? And then the remaining 4 months is just to continue management. That one is done with 2 drugs and it's for 4 months. So that's like for that category. There are other categories in which that you could take that treatment up to 8 months. Yeah, because if you have a drug-resistant TB, you could have a relapse.
Relapse.
Yeah, so you could be, the first category we mentioned, you could be undergoing your treatment and of course, at some point, you have to be investigated too. They do your chest x-ray and then get your sputum for analysis. If you're taking the medication and for whatever reason, you're still positive from the test. So,
All right. So what are the general preventive measures for tuberculosis?
well, first of all, I'll start with there's a BCG vaccine
For children?
for children. So I think everyone has that scar. You have the scar. Eh?
Yes, I have mine here.
Oh, why is it there? It's supposed to be here.
I don't think
I think mine is
I
here.
think mine is not showing.
Well, I assume this is mine because I know I got it from a vaccination when I was small.
You assume that's yours? I know that scar to be here. Because during the pediatric process, when you're evaluating children, you always have to look out for the scar. Does he or she have a BCG scar? So at least you know what to...
Okay. Let's take this comment on Facebook more like a question, and it's from Daniel Ose. It said, I am unable to cough this phlegm in my throat. What do I do, please?
He's unable
to cough the phlegm
Like
in his
expectorate,
throat.
yes.
Oh, but he's been coughing more than 2 weeks. That's what that means, eh?
Well,
Well,
we
he
can
didn't
assume
specify.
that. He didn't say
specify,
that
yes.
exactly.
Oh, okay. I will assume probably he's been coughing for more than 2 weeks or he's not productive. Apart from the sputum, a gastric aspirate can be used, like an aspiration from the gastric means stomach.
Okay.
So like they put a tube and they try to aspirate the content from your stomach, and it could be used for gene parts to test for tuberculosis. So if he can, cough out.
Definitely
basically just see a doctor.
See a doctor.
Yeah, he will
Go
definitely
to
have
the
to see a
clinic.
doctor. Yeah, and then a blood culture can also be done. Yeah,
What's a blood culture?
a blood culture is like take a sample of your blood,
Blood
and then they try to.
Okay, analyzing
Like-
microorganism or culture. I think I know what that is.
So
All right.
if Mycobacterium tuberculosis is seen in it, then
They'll identify it.
yeah.
Thank you. Thank you very
Thank you
much
so
for
much.
the enlightening
And then
session.
for
You wanna
more,
say something?
more prevention,
Okay.
is just to, identify the risk factors that we mentioned earlier on. If you have any of them, it's better to go to the doctor and you're screened and you don't have it than for you to sit back at home and say, it's not my portion. That's what most people do. Yeah, like you know how the religion thing is. Yeah, so they say, oh no, it's not my portion. I can't have tuberculosis, and so you have to, avoid overcrowding.
Okay.
Yeah, and then you have to wash your hands as soon as possible.
True.
Hand washing, hand hygiene can save a lot of infections.
A lot of infections.
Yeah, and then if you're sneezing, you should try to use like a handkerchief or something and cover up when you're sneezing. And if you sneeze, you should be responsible enough to wash your hands before you shake other people. And so
yeah, we have another question from someone on Facebook, and she's asking if it's a terminal illness or a disease. Do you die from tuberculosis? Now, we want to assume that we know, but you as the expert, is it terminal? Do you die from it?
But without treatment, you can die from tuberculosis.
Without treatment,
without treatment,
you can be saved.
It's curable. So that's why you need to come, and then we enroll you into the treatment program.
Okay.
It is curable. At the end of the program, you could be declared smear negative for tuberculosis. It will be gone, and it's not gone. But without treatment, yes, you can die from tuberculosis. I need to sound that one very loud.
Okay.
Yes, the alarm has been...
Yeah, ring the bell. The thing, like we said earlier, is it's time to end tuberculosis. This is 2019.
Yes.
We need to, put hands together, resources, all hands on deck, and we need to get the word out there. Awareness, because a lot of people don't know what you can do about it. And particularly the drug-resistant tuberculosis. I think you need to reiterate that, because some people, once they take it, say if the doctor advises you take this treatment for 4 months, once they start taking it by 2 months and they feel they are okay, they stop it. So please shed more light on the drug-resistant tuberculosis.
So drug-resistant tuberculosis, one of the things that causes drug-resistant tuberculosis is if, one, you don't adhere to your drugs, just like you said. That only does not occur in tuberculosis. In everything. It's so sad that we're going to be dealing with resistance to malaria medicine and antibiotics very soon, because people abuse those medicines. Any little thing, everybody runs to antibiotics.
Sure.
So if you're supposed to take your medications every day, and you take it on the days you feel like you might be dealing with drug-resistant tuberculosis, and if you're taking the wrong regimen, because there are first and second line drugs, so in all cases you just have to go see your doctor. So most of the times you might not really be very smart or wise to start saying the name of these drugs out here, so people don't go start looking for, because for one reason or the other, people just don't like going to the hospital. I don't know. I mean, when I talk to people, they say, "Oh, we don't like hospital," and I reply, "Say, oh, I don't either. Nobody likes the hospital." But then there are our health-seeking behavior should really improve.
Okay.
So if you do not take the right regimen, and if you do not comply with the dosage and frequency,
it can kill you.
It could come up with drug-resistant tuberculosis. Okay. And I also need to add that treatment of tuberculosis is free.
Oh.
Please, everyone is free. I mean, we like our wooftails.
No, it's just new knowledge, I suppose.
Yeah.
Oh, really? Oh, yeah.
Please say that again so that someone can catch it.
Treatment for tuberculosis is free.
Free.
Treatment of HIV
is free. Wow, that is very good. I think that's a very good
at least for now, because there are some nice people. People tend to say that life is not fair, but there are really nice people in the world, and some people who came together, some organizations who came together and put up money together, and they sent, and it was for the purpose of procuring HIV and tuberculosis medication, and the target regions were third world countries or places with low socioeconomic status.
So let's just hold that. We have a caller from Ibafo. We follow her from Ibafo.
Hello, Modupe. Hello, Shion. You guys look great. I love your T-shirt.
Thank you.
Okay. My question is for the guest. Okay. For someone that is battling with tuberculosis, what kind of medications would you prescribe to such person, and what are the precautions for such person? Thank you so much. Bye.
Bye.
Should I work on the medications, yeah?
Yes.
Oh, okay. Like I said, there's a regimen,
Okay.
all right? So the tuberculosis medicine is not what we prescribe for you to go to the pharmacy to buy.
Okay.
There's a tuberculosis program, and those drugs that are free, actually, there's something called direct observed therapy. You taking those drugs are supposed to be in the presence of your healthcare.
Let's do that in 30 seconds.
Yes.
Let's answer that question in 30 seconds.
Oh, yeah. So, okay, we can't write a prescription for you to go to the pharmacy to get a drug.
Okay.
You need to go to a hospital
Yeah.
to get enrolled in the tuberculosis program,
Okay.
and you get your medications for free.
All right.
You don't need to worry about the type of medicine.
Thank
taken
you.
care of.
Okay, so quickly also we have this question, and it's from Tohib Habib, and he's saying, how fast can the tuberculosis spread among people in the workplace or an environment?
Oh, well, okay. That also depends on the strength of your immune system. So it's like a progression. So if you inhale the droplets, it gets into, from your nostrils, through your nostrils anyway, so it gets into your lungs, and it gets into your lymphatic system, your lymph nodes, and then it starts, it first of all forms a primary infection in the lungs. Like, you know, the types of tuberculosis, we have like a pulmonary tuberculosis, the ones that occurs in the lungs, and
Yes.
extra pulmonary, the one that occurs outside the
Outside
lungs,
the
going to
lungs.
the maybe abdominal organs, the spine, and the bones. So depending on the strength of your immune system,
Okay.
because like actually there's going to be a war between the mycobacterium tuberculosis and your immune system.
Okay, so the strength of
So
your
the strength of your immune
system
system depends on how fast
it
it
will
will
spread.
progress.
All right.
Yeah,
Thank
but
you.
the short thing to do is to go get tested and start treatment.
Yes.
If there's no treatment, it will surely spread.
Thank you.
Thank you so
very
much,
much.
Dr. Charles. Okay, so we're wrapping up this segment, and we are going straight into our next interview segment. So please do stay glued. Keep the questions coming on Facebook. And of course, the phone line is open as soon as we are back from this break. So please do stay glued. We'll be right back.
To enjoy more interesting episodes of Tea or Coffee, then like and subscribe.